Welcome to Being in Motherhood. We're your hosts, Kendra Fitzgerald and Nicole Coons, sisters, moms, and the co-founders of Devoted Mamas.
This show is all about you and using your perfectly messy, absurd, and marvelous experiences in motherhood as opportunities to hone your greatest qualities.
Because your family deserves the best of you, not the most of you.
You'll gain the tools to be a bold advocate for yourself in pregnancy, claim your joy in birth, and find wholeness in postpartum.
Being in Motherhood starts right here.
In today's episode, we're talking pelvic physical therapy versus corrective exercise. You might be wondering, what are they, when to seek them out, and why the heck you would need either one. And we're going to give you at the end our suggestion on what gets the best results. To begin with, why the heck do you need either one, PT or corrective exercise, when you're pregnant or postpartum? Nicole, we get this question all the time, don't we?
Yes. Well, first of all, pain. Moms experiencing pain through pregnancy, in postpartum, definitely all kinds of pain, hip pain, back pain, shoulder pain, neck pain, knee pain, ankle pain. Do I need to go on? Dealing with diastasis, lower abdominal weakness, or even a belly pooch. So PT or corrective exercise can be your go-tos for addressing the pain. Now, you also may be hesitating about pushing yourself because you still feel a little disconnected to your body, or you may be doing nothing because you just don't know where to start. And you have to make enough decisions every day as a mom. So when it comes to trying to decide something that feels so foreign and overwhelming and disconnected, it feels impossible to do. So we are here to remove some of that overwhelm and let you know that there are ways of healing, some modalities out there, namely PT and corrective exercise, that are out there that can help you. So I just want to take a quick aside here to say, this discussion is really important for us to have because this information is not being adequately shared with new moms. You might be experiencing pain, hip pain, stomach pain, rib pain, shoulder, all these different pains. And then you go to your doctor or other medical providers and they're either dismissing them, they're minimizing them, saying, well, it just takes time to heal. Maybe they're giving you suggestions to drink more wine or to get more sleep or just to take a relaxant of some sort when that's really, deep down, that's not actually what you need. And many medical providers don't mention things like PT and definitely not corrective exercise because they don't really know what it is unless you ask for it. And of course, it's hard for you as a mom to know what to ask for if you don't know it exists or you don't know why it exists. And by the way, you don't need a prescription for corrective exercise or a referral for that matter. You really just need doctor's clearance to exercise. So we can really acknowledge that we don't need our medical providers to provide all of the information. So the fact that they're maybe falling short of helping you address your needs may not be their fault. It's simply the limitation of the medical system. And so now we as moms are in the driver's seat, but somewhat without a manual. So we're going to give you the information today, give you some insight and some things to think about, and to really help you discern for yourself if corrective exercise and PT or a combination of the two are going to really help you in your healing. So why do we need to heal from pregnancy and even in postpartum in such a way that requires a specific treatment or approach? Like, why can't we just go straight back into just doing stuff? Like, why do we even need this extra step? Some might think like, oh, it's so extra, I don't need it. Because we don't hear moms talking about it. We don't hear moms saying that they're doing it. We don't hear our medical providers talking about it. So yeah, it may feel like this is just extra, but it's really not. Why? Kendra?
Yeah, we have to think of pregnancy as a specific treatment approach or a specific approach for pregnancy and postpartum. Just like we've talked about before in some of the earlier episodes of, pregnancy impacts on the body. Things like, your ribs shift, your hips shift, your knees get affected, your shoulders, your back, even your ankles, your tendons, your ligaments, everything kind of shape shifts when you are pregnant and then, kind of stays that way in postpartum. And even the skeletal system, we really have to acknowledge that is really important because it's the muscles that move the bones, right? When we're pregnant, The ribs and hips get wider, and the posture of a pregnant person morphs over 9, maybe 10 months to make room for the baby. And that's long enough to create a posture that's permanent if you don't do anything about it. So there are
Yeah.
literally moms who are pregnant who don't recognize the fact that the body morphs during pregnancy, don't do anything to mold the body back into a non-pregnant state. And then at that point, you're basically building strength on top of a pregnant body framework, even though you're not pregnant anymore.
Yeah. And then we get frustrated that we have a pooch. When you can't catch your breath, you run out of energy by noon. And goodness, the pain. There's really good chance that your body is working overtime trying to find the strength and the steadiness in this expanded skeletal structure and a muscle system that's holding the pregnant structure in place. So I don't know if listeners, if you're following, are you with us on this? Are you starting to get the idea about why you might need an approach that addresses the underlying alignment and function? And that's exactly what both PT and corrective exercise do, is that they're not just putting you through the paces of moving muscles. Both instances are looking at that underlying morphing that happened and helping put the body back into a better alignment for postpartum, for life as not pregnant.
Yeah, exactly. But so let's take it back a step to those who are pregnant, because I know we have listeners who are
Mhm.
pregnant. Your goal as a pregnant person is to give the body a container for your pregnancy and all the skeletal shifts and muscle changes that are inevitably going to happen, right? We need it to happen to accommodate the baby during your pregnancy. Allow your body to change to accommodate the pregnancy. It has to change, it's inevitable. But also, it's a great time to stay connected to the muscles that are being impacted. In other words, pregnancy is not a time to just let it all go, let it all hang out. It's a great time to keep a foundation of strength and keep a little bit of, firmness around the expansion that's happening.
Right. Now, let's be clear what we're talking about when it comes to bringing the body back into good alignment and healing the body postpartum. We're not talking about body composition insofar as it includes weight. So, this is not about staying small or thin or compact. It's about the function of the muscles and the connective tissue. So, just to say it really simply, if we keep our muscles and our connective tissue strong and supple in pregnancy and in postpartum, you'll have a shorter distance to travel, whether you're starting out in postpartum or you're even starting out in pregnancy. You're just going to have a shorter distance to travel to get everything back into a good functional tone in your non pregnant body. So, we've talked about why a special approach is important. A special approach is important because the body has shifted a lot, and just stacking old exercises onto a body that is still structurally pregnant is not going to get you far in your recovery. So, we're going to dive now deeper into these two approaches, pelvic PT or pelvic physical therapy and corrective exercise, that are the most beneficial places to start. And they're also the most accessible. So, Kendra, why don't you walk us through PT,
Yeah.
pelvic physical therapy, pelvic PT?
Pelvic PT, pelvic physical therapy, is a specialty of physical therapy. So, obviously, physical therapists or physiotherapists, depending on where in the world you're living, they are licensed healthcare pros. They treat with a medical diagnosis. They deal a lot with physical traumas, specific injuries in terms of birth. That might be like vaginal tearing or prolapse. And they also work with post surgery rehab. It's often prescribed as an alternative to surgery, which you could find like in a hernia situation as well, and to manage long-term medical conditions. So they're really trained to work with complicated diagnosis like MS, spina bifida, things like this, where PT will understand the progression of that medical condition. So, what is specific about a pelvic floor physical therapist is that they are focused on issues concerning the pelvic floor, such as bladder leakage, prolapse, constipation, pain with intercourse, scar tissue, things that associate with pelvic floor dysfunction. They treat women as well as men and children, and they are extremely helpful for women to see during the perinatal years specifically, and even after you've had a baby, because pregnancy, birth, and postpartum have such an impact on the pelvic floor. It causes pelvic pain, leaking, and prolapse issues, and these can be either during pregnancy or postpartum. I think this is one of the biggest takeaways for our pregnant listeners is you want to build a relationship with a pelvic floor PT early in your pregnancy because it's a great relationship to have through your entire motherhood and for when you get older too. And we truly believe that every mother should have an evaluation by a pelvic floor PT, if even just to get a baseline and information to establish that relationship for the future. It's very common in other countries. So we're in the United States. If you're not in the United States, you might have a different approach to pelvic floor physical therapy, but here in the United States, it is not a given that mothers go to pelvic floor physical therapy. Whereas a lot of other places, like I know France, they get 10 to 12, I think, appointments with pelvic floor physical therapy that is included in a postpartum plan. So in the United States, we're working a little bit behind that. We'll talk about that in another episode. I have more to say on that.
Yeah.
But essentially, pelvic floor PT is really helpful for managing some of those issues that come up during pregnancy and postpartum. Now, when we turn to corrective exercise, which is what we are not pelvic floor PTs, we are corrective exercise specialists. So, corrective exercise is a method of exercise training that uses the science of biomechanics and neuroprogramming to fix movement compensation patterns. That's a really fancy way of saying basically like turning on the right muscles and getting cranky muscles to calm down. That's the easy way to say it.
For good. Yeah.
Right? For good. We do not diagnose or treat medical conditions, but we do account for them in our work. We're not PTs, but we have a very specific training in corrective exercise that is based in PT theory, and we work very often alongside physical therapists. So what we do with the typical corrective exercise client, we assess and evaluate a client's muscle and skeletal system for places that things might be stuck, like movements, stickiness, any imbalances that might have been before pregnancy or created by pregnancy, habitual patterns, and even some muscle dysfunction. And these things might be things that affect a person's ability to move well. You might find that like suddenly you're not able to pick up your kid as often as you did, or the stairs you used to climb all the time are suddenly a lot harder to climb now because your sciatic joint is in pain. I find corrective exercise really helpful in helping people exercise effectively and do their daily activities without pain. I also find corrective exercises really useful when you're starting a fitness program, either resuming it after pregnancy or continuing one without experiencing pain, these movement limitations, and having a lot of setbacks.
So important. And to add to that, pregnancy and postpartum corrective exercise, which is, again, a specialty of corrective exercise, pregnancy and postpartum corrective exercise is specific to the perinatal body, taking into consideration all the things we just talked about, the intricacies of the pelvis, the hips, the deep muscle system of the back and the core. So it's not just what happened in pregnancy, but it's the additional impact of postpartum that we factor in when we're working as corrective exercise specialists for postpartum and for pregnancy as well. And what we see is that it's not just the exercises themselves, it's how those exercises are being translated into your everyday life. I mean, think about it. In postpartum, we've got this squishy, squirmy baby that wants to be held all the time. Then you add a 30-pound car seat, carrying the baby in the car seat, and then a stroller that needs lifting in and out of the car, heavy bags up and down stairs, just contorting our bodies, putting our bodies through massive paces. And so really postpartum corrective exercise is part doing movement and getting correction in the muscle patterns, but then applying that into your everyday life. And this is a huge, huge piece of corrective exercise in the way that we work with our clients that helps you get results, because in fact, you're not actually doing your repair work 30 minutes or 5 minutes a day. Your life becomes your opportunity for repair and restoration.
And I would add on, like, the amount of physical labor we do as mothers is pretty shocking. I'm sure you guys have
It's a lot.
felt it.
Yeah.
It's a lot. Yeah. We're making the case for not just jumping back into your pre-pregnancy classes. Our goal is really to help you be decisive and take smart action and get the results from your own self-care and stop wasting your time, right? We don't want you to waste your time to try to figure out what's right or what to do first. We really want to take out some of the guesswork so that you can feel confident in the path that you're going down which is a really calm and clear place to operate from in the chaos of motherhood, right?
Too many moms spend years feeling frustrated about the speed of their postpartum recovery. Their back and hip pain is getting worse. They don't know what kind of exercise is safe. They miss fitting into their pre-pregnancy clothes and feel deflated not being able to run after their kids at the park because of pain, leaking, or overall squishiness. Can you relate?
The real problem is that these moms haven't figured out which phase of postpartum recovery they're in. There are actually 4 phases a mother goes through to being fully recovered physically. Would you like to know where you are on your path to full recovery? Take our postpartum pelvic floor and core strength quiz to find out.
Visit devotedmamas.com/quiz. When you do, you'll learn exactly which exercises will move the needle forward on your fitness so you can stop feeling discouraged and start feeling like yourself again.
Get your score and exercise plan today at devotedmamas.com/quiz. And I want to step back for a second too and just kind of highlight how pregnancy and postpartum corrective exercise is different than general exercise. So general exercise is kind of like weightlifting or running or CrossFit, other forms of like dynamic exercise. So they're things that are focused on increasing your general fitness. What this assumes is that you're not injured and you don't have underlying issues though. But if you remember from before, what we've already established is that if you're postpartum, you inherently have underlying issues.
Yeah.
In fact, we found a research study that said that 90% of personal training clients report recurring aches, pains, and movement dysfunction that affects their ability to exercise without limitations. That's a lot, right? 90%.
That's a lot.
That's a lot. So at some point, you could venture to say that every single person who does general exercise at some point is going to need corrective exercise, which is kind of awesome. But everybody in prenatal and postpartum needs it.
Right. So, and that increases even more if you've gone through pregnancy and you are recovering from that. So for sure, 100% of people are likely reporting, of moms are reporting aches and pains and movement dysfunction that affect their ability to feel good and to move through their day with ease. So we truly believe that as women, we should see a pelvic PT during motherhood. And women need to work with a postpartum corrective exercise specialist as they make the transition from newly postpartum back to everyday life and general fitness. And our goal is to get you back to general fitness where you don't have underlying issues holding you back and you can do all the things you love to do. So that's the goal, right? You're not going to be doing PT and or corrective exercise forever. It's a stair step, a really important one on your way to those even more exciting and fun things that you love doing.
That's right.
So we love examples. Kendra, you have some different scenarios that are maybe some people out there listening can relate to, will help you kind of decide, okay, do I need to start with PT or do I need to start with corrective exercise or both?
Yeah, I think that's the biggest question is like when to do each one. And every scenario is a little bit different. So I'm going to take you through 3 different scenarios. The first one, say you have a medical diagnosis, a physical injury, or you've been told by your doctor that you need surgery for something, or you have acute pain that is keeping you from doing your everyday lifestyle things. You want acute pain resolution now, right? Then your first stop is PT. That's scenario 1. Scenario 2 is you've been cleared for exercise by your doctor, but everything kind of feels a little bit off. You might be hesitating, dabbling, and maybe have pain, but it's not enough to send you to the doctor, but it is impacting your day and your mindset. So in that case, your first step is a postpartum corrective exercise specialist. And then scenario 3 is perhaps you have an appointment with a pelvic PT, or you're already seeing a pelvic PT, or you either have to wait a while to get those appointments because unfortunately pelvic floor PTs are few and far between. There are not a lot of them, so sometimes you have to wait for an appointment. Or you want to get the most out of your time with your PT and really integrate what they're teaching you in your PT sessions into your lifestyle. In that case, doing pelvic floor physical therapy and corrective exercise at the same time is a really good solution. So we've really found that people who use pelvic floor PT and postpartum corrective exercise training together see the best results, really. I mean, the PTs we work with love our clients as patients because they come in with a great amount of detail about what they're feeling and specific data that helps the PT do their job better, and vice versa. When we have a client who goes to see a PT, it helps us do our job better too. So working together in coordination is just phenomenal.
Totally. Yeah. So let's talk about a little bit more about how PTs and corrective exercise specialists work together. One example is, so your PT is likely going to give you some exercises, some, one or two, maybe three things that they want you to work on. So let's say they give you hip bridges to strengthen your proximal hamstrings. Then in your workout routine, you're doing suitcase deadlifts or squats, and you haven't made the connection of that proximal hamstring work that you're doing with the PT into your squat or deadlift motion. And you're likely going to revert back to that comfortable movement pattern that you're used to. So basically, you're doing it correctly on the PT exercise, but then you're kind of losing you're not connecting the dots of what you did there to your other things. And you'll kind of not quite undoing the work you're doing, but you're just not progressing across the board with the work that you're doing with a PT. So working together, which is really the optimal situation, say you're being given exercises by your PT, then with corrective exercise, we take a look at that exercise or that set of exercises and begin to apply it into other exercise moves that you're doing, into everyday lifestyle things, and give you slightly more programming so that you feel more confident to integrate what you're learning from your PT into your everyday movement and your everyday workouts.
It's really common when we work with our clients who are also working with a PT that we actually have a communication and talk back and forth between the pelvic floor PT and ourselves. We compare notes, of course, given permission by the client, but we make sure that they're working in coordination together and we're not, the things that we're doing are progressing the work that you're doing in PT.
Yeah. And we see such quick progress in this scenario. So another scenario, the way that we work together is, let's say you start working with a postpartum corrective exercise specialist, and in correcting the imbalances of, let's say, your deep hip rotators, you develop an awareness of pain near the area where you tore during childbirth. So in this case, a visit to a pelvic floor physical therapist can help you release that scar tissue. Or maybe you had an episiotomy, same thing. A pelvic floor physical therapist can help you release the scar tissue, which is going to give you better access to those muscles of the pelvic floor. The same would be true if you had a C-section. A PT can really help release adhesions in your scar tissue that can help you access your deep core better. So as you can see in this example, corrective exercise and PT working together, PT is there to help you move beyond when you have some roadblocks that come up as we begin working together. So they do work really well together. And sometimes if you begin with PT, you might find that they can only take you so far. And corrective exercise is that piece that can take you to the next step. So Kendra, how do you see that progression happening from pelvic PT and corrective exercise?
Yeah, I think, PT, like you said, can help you get to the point of getting out of pain. And honestly, and also if you're in the United States, that can also be a limitation of the insurance model, right? Like once you're out of pain, the
Mm,
PT can no longer work on you. And so I think the corrective exercise picks up where PT sometimes has to leave off because of insurance or, other reasons. And then it's on to exercise. And then sometimes you might be left to figure it out on your own from that point. So this is really where corrective exercise can pick up. Once that pain is resolved and you want to keep building on that, corrective exercise can help you transition easily and fluidly into a more intensive exercise program.
yeah. And I want to add to that too, that let's say you go to PT, you finish your treatment from there, you're feeling good, you hop back into regular exercise. And sometimes we will experience pain that is related to imbalances caused by pregnancy. And we might talk about it with our teacher or coach or personal trainer that we might be working with. But if they're not knowledgeable specifically about postpartum corrective exercise and the nuances of the pelvis and the deep core, plus you might just have some hesitation. Like you're not going to tell just everyone that you experience some heaviness in the front side of your, or near your rectum, or you're experiencing leaking. That may not be information you're comfortable sharing with just anyone. And when you have a corrective exercise specialist in your corner, that kind of conversation becomes easy to have and normal, and because it's not shameful. Those are clues and indications and things that we look for as clues about what's going on and how to program your movement. So
Yeah.
corrective exercise, it's like a secret tool that just works so cool.
I would actually add too that, I've had several general personal trainers have a client who either is pregnant or has recently had a baby, and they've actually said, like, can you help her? Because this is out of my wheelhouse. I don't really understand what's happening. And the benefit of prenatal and postpartum corrective exercise is that it is so specific and it is a certain amount of time. And we take a full view of the postpartum body, and it's only a short amount of time. It's not, like you said before, we're not going to be doing PT and postpartum corrective exercise forever, but we do have to do it. Because
That's
if you
right.
don't do it, you might
Yeah.
have to come back when you're 60 and do it then. But if you do it now, it sticks.
Yeah. And really, so the bottom line is to get the best results, you don't have to do PT and corrective exercise in a certain order. However, doing both is best. And using them together may be monetarily the most cost-effective way to get full recovery and potentially even stronger than before you had kids, right?
That's right.
We've definitely seen that. So
Yeah.
our best advice on how to kind of weigh the how much PT, how much corrective exercise, and which one should you do is you might need to look at your insurance as well if you're looking to use insurance to help you with this. But our best advice is to use pelvic physical therapy for the targeted medical treatment that it can give you. And then milk corrective exercise for how far it can take you in building a great and strong body. We love corrective exercise, if that isn't obvious by now. And corrective exercise is often, I want to say always, that missing piece of the puzzle that comes before getting back to doing everything you love to do without pain.
Yeah.
And as a side note, we recently added up all the hours and resources that we dedicate to supporting moms in their postpartum recovery, which, if we were working under the insurance model, would translate into about 50 medical appointments or visits, 50 visits, which is roughly $12,000. And you would surely max out your deductible if you were doing this and probably exceed your allowance of specialist visits, which is usually 12, not 50. And the truth is, you don't have to spend $12,000 or more to get full recovery when you can smartly use corrective exercise for what it's for in conjunction with targeted pelvic PT support and treatment. So really, in summary, postpartum corrective exercise is a perfect first step for everyone in pregnancy, in the early stages of postpartum, and even later postpartum. So Kendra, is there anything else you want to say before we close?
I have a feeling there are still some listeners out there who might be like, what exactly is corrective exercise? What does it feel like? So I kind of want to
Mhm.
go into like, what's the experience of doing corrective exercise? Because I've had that question asked quite a bit of clients who haven't worked with us before. They're like, what do you do in a corrective exercise session? And it's not like CrossFit or any kind of typical training you might have done. It's not just a general workout session. What we've been told is that it feels like gentle reworking, gentle reawakening, like a massage from your muscles. It's pretty awesome. It's meticulous and specific, but it's also really digestible. And it's all about getting you into your own body. And it's also integrating it into your lifestyle. And I've found in my experience as a trainer that corrective exercise is incredibly powerful because you can get so detailed with the movements that then when you add on the gross movements of, more general fitness of running and all of these things, it's so much easier and there's so much less effort because you're working with your body mechanics and you're working with how your body works the best.
Yeah. The other final thing I'll add about what's different about corrective exercise is that there's this huge mind-body connection, which is also one of the main reasons I love it so much. There's a huge mental component to rewiring the way our muscles connect and fire, the way we hold our body. There's a mental piece of it. And what's cool to see is how we build that connection mind-body to create the effects that we want. And in the beginning, it can feel like more mental effort than physical. And then gradually, as we start to see these patterns connect, right? The synapses are there. We no longer think about it anymore. And we start seeing the muscles, which have memory, of course, because they're living tissue. The muscles start to do this stuff on their own. And that is such a cool thing to witness in our clients and see them go from that place of being more of a mental challenge to getting into the actual fitness challenge of it. And it's just so powerful. And it's also very tangible. You can really see and feel it working, which is so gratifying, right? Like raising these little babies, like, is it working? I don't know.
Yeah. Well, it's also funny because like when I'm working with a lot of corrective exercise clients, it's like we're doing like tiny, tiny little movements and they're like, why am I sweating? Because we're like reprogramming things. And, it takes a lot of body effort to make that happen. And then you feel it the next day. That's the other thing is the next day they're like, why am I so sore? I'm like, because we're working muscles that haven't been turned on in a while. So tangible.
That's right.
Yeah.
It's so tangible. And there's no question that you're making progress, which is extremely motivating, as we know.
Definitely.
If you're listening to this conversation and you identify with some of the challenges that we've talked about today, and maybe you're curious if corrective exercise could be your missing piece of the puzzle for you, for your healing, listening today is just the first step. You don't have to stay in that place of frustration, hesitation, and procrastination. We are here to support moms just like you. Send us a message and tell us about your fitness goals and let us know what's holding you back. And we will work with you on developing a plan. Thanks for listening. If you enjoyed this episode and you'd like to help support the Being in Motherhood podcast by Devoted Mamas, please share it with other mothers and leave a review.
As always, you can find us on Instagram at Devoted Mamas and check out all links and resources in the show notes. Be courageous and stay devoted to growing into your best self as a mom.